I'm Joy Wolfram. I'm an associate professor at the Australian Institute for Bioengineering and Nanotechnology and the School of Chemical Engineering at the University of Queensland in Brisbane, Australia. So I started out doing a bachelor's degree in biology in my home country in Finland, and then went on to do a master's degree in biology. After that, I switched to a degree with more of an engineering focus, so I did a PhD in nanotechnology in China. Then I worked for over 10 years in hospitals in the United States, and now I'm here at the University of Queensland, and it's really been great being able to break the artificial boundaries between disciplines, and by taking this multidisciplinary approach, we can expand the toolkit that we use to solve healthcare problems. My lab works with the text message system of the body. So the scientific term is extracellular vesicles. And these extracellular vesicles are important messengers between nearby cells, so neighboring cells in the same tissue, but also between cells in different organs, so long-distance communication. And they really impact both health and disease. My research group is working on bad extracellular vesicles, but also good extracellular vesicles. In terms of the bad messages, we're looking at cancer, and specifically breast cancer. And we know that when cancer cells release these extracellular vesicles, it helps them grow and invade into other areas of the body. We want to understand what these messages are, what these extracellular vesicles contain, and how can we block them to enable us to treat breast cancer. On the other end, we also work with the good extracellular vesicles, the good messages, and healthy people have a lot of good extracellular vesicles circulating in their bodies. We want to leverage that, so we want to find the right extracellular vesicles, we want to optimize them, we want to engineer them to be able to treat life-threatening diseases and improve the quality of life. And for example, we're working on treating diabetic kidney disease. In terms of the collaborations, we've formed strong collaborations locally with the Faculty of Medicine here at the University of Queensland that is, for example, enabled by my funding from the National Breast Cancer Foundation. We also collaborate with hospitals in the United States, and this is enabled through my funding from the National Institutes of Health, which is the largest funding body for medical research in the world. And there we're developing these extracellular vesicle therapeutics to treat aging diabetic kidney disease. We also have collaborations with many companies, locally and internationally. And what's important to note is that we collaborate with patient advocates and clinicians, and we include consumers as investigators on our grants to get that important, valuable knowledge of what is the clinically relevant questions that we should ask, and what is the pressing medical needs that we should try to tackle. And Health Translation Queensland has enabled us to remunerate, to pay our consumers for their valuable time. So I would like to thank these funding agencies for supporting us. And this is the type of challenge that requires teamwork from scientists and physicians who dedicate their lives to this battle. And we keep going thanks to inspiration from patients. And I believe that if we keep working on these nanomedicines, we will be able to reduce harm to healthy organs, improve quality of life, and save future patients. I'm very passionate in my research, and what drives my passion are the patients. So the potential to save lives and improve quality of life, and that's really what makes my team get up every morning and work hard, is to have that impact on the world, especially on those people who are struggling with diseases like breast cancer or diabetic kidney disease. And this is also why we have several clinicians on the team to make sure that we can do work that is clinically relevant. I would say that I haven't worked a day in my life because it's such a privilege to solve complex puzzles that have the potential to improve the world. But what I like to do outside my play, which is research, is to walk my dog Sandra and I've lived in many cities all over the world, and I would say that Brisbane in Australia stands out for its wonderful opportunities, parks, hiking trails, and nature, and it's really refreshing to be out and have that opportunity to interact with nature, and some of the best ideas scientifically actually come in these instances when you're not doing research.